coffee.
Oh, she didn't refill it?
I think it's filled.
You like what you took?
We're getting a refill on the coffee.
Okay.
Yeah. The problem was so noisy, it was difficult to hear. Yeah, but I understood on the yes.
היה ב-JFK אתמול? מאוד מעניין. אבל לא פגשתם את כיף. לא. כיף סוויסמן. הוא למד שנה מעליי באותה תוכנית לבית. הוא כתב את ה-reviews הכי חשובים בתחום של אפיקסי של תוכנית התאמות. הוא עשה סדרה של...
מעדכנים את זה כל כמה שנים.
זה היה מישהו של
Okay, guys. So sorry to interrupt. We're here to have an informal discussion hour with our eminent Dr. Yehuda Ben-Yashay. This is a wonderful opportunity for us all to have access to one of the main forefathers of our profession. So I know you're all very excited to speak with him. And please, go ahead.
I'm more convinced than ever that the holistic approach is the way to go, because all the new things that they are trying to experience now with oxygenation, normobaric, hyperbaric oxygenation we have been around, they are wonderful, but you also have to take care of the person. You have to take care of how the person feels, and as you have seen, Adam, how he gets along with his wife and his children, and those things you don't get by sucking in oxygen. Done with the speech.
Can I ask about the daycare therapy?
Absolutely.
Okay. I saw that at the beginning, Adam read from the board some kind of statement, and I wanted to know who wrote the statement, and did he wrote it by himself? Did he consult with his therapist?
Gotcha. So, did everybody hear the question?
Mm-hmm.
Okay. This has been going on now for years like that. The staff has given Adam on the left side what were the problems in awareness, understanding, malleability, compensation, and then functioning as a human being, and acceptance. And as you could see, he fulfilled all of these things. So this is what the staff presents to him, and he has to demonstrate that he understands everything and he accepts everything, which he did beautifully. And that's why he was invited to join the peer councils, which is not happening all the time. So this is the statement the staff together decides, and then he is presented with this. It's instead of the big report that they do for the final report.
What is a cycle? At the beginning they said, I'm graduating my second cycle, my third cycle.
Sure.
What the cycle
I tell you, I'm looking around now the members of the staff, and cycle has started and it remains the same thing. It's a 20-week program. Every day, 4 days a week, from Monday through Friday. Friday the staff plans, presents, and prepares. And what they go through in these 20 weeks is a very intensive program. And they don't leave here after one cycle. If necessary, some of them go through 2 or 3 cycles until they are ready to be going on into the world, and hopefully some of them go back to work differently than they did before. So the cycle is a 20-week intensive cycle, and then you repeat it if necessary once or twice or even 3 times.
What does it encompass? What
Right.
are the, yeah.
What
What are the building blocks of the
Okay.
cycle?
The program is arranged every day, basically the same thing. The first session of the day, it doesn't matter whether it's 45 minutes or 50 minutes, is orientation. So basically during orientation, people have to say, what am I doing here? Very personally. And during the orientation, is they presented each one, you saw the posters there, with the basic poster which focuses on the major problem that the individual shows and what he should do. The next session is a group exercise in which individual people are called up, and they have a coach. You have the presenter and the coach, and then they are presented with particular thing. For example, why don't you tell the group an experience that was particularly important for you in earlier life? And they are entitled to say about work or studies or habits and accomplishment. And when they are presenting, and of course the coach makes sure that the person is malleable, accepting the coaching. It's a demonstration there. Every single person who attends the group, including many times visitors, are giving feedback. How the person behaved, the body language, the tone of voice, and everything. So every day they go through this thing, and it's like an onion peel backwards. Layer after layer after layer, until they become what the last word was, habituated in this kind of living. The significant others are welcome to visit every day if they don't work and they can make it, and many of them do, at least 30-40% do, and they also participate in person in what's going on by watching. That's a cycle. After the orientation, they go to lunch by themselves, with each other, not with the staff. And after lunch, individually, they receive intensive cognitive training. Each one according to his needs. So you have different courses: attention, concentration, visual perception, eye-hand coordination, whatever they go through. There is no particular training for memory. Memory is an outgrowth of the improvement in the person's overall functioning. So if you had impulsivity, or if you had attentional problems, and you have problems in over-emotionally, all of these things slowly have to peel away in order for the person to move on in each of the courses. After the cognitive, they get together, and it's called the end of the day. Now I'm blocking.
Community.
Community, thank you, Eli. The community session is important issues that are raised that have to do with being part of the rehabilitation. So a staff person who is chairing this, and each time different staff members chair this, will raise, let's say, a question, why is it important to be malleable? Or a real question which has to do with practically functioning in the family and so on. And then each one of the individuals prepare in a minute or two a short statement. They make their statements, and the staff members who are there comment on the statement, how clear, how concise, and how to the point the statement was, and that's the end of the day. Now, after all this is over, individuals go in for personal counseling. Only them, and in personal counseling, members of the family who are significant others, very important, or if you have no friends, no family, then you have significant friends, they also participate in these sessions. So it's a long day starting usually for them at 9 o'clock. From 8 to 9 the staff plans. It's always planning, preparing, plotting, how to do it, what to do, and how to approach different people. And then comes the real show. And they go home. Tomorrow is the same thing until Friday.
May I add 2 points? One thing you mentioned, significant others. I remember that one of the criteria for Yehuda to accept people to the program is the commitment of the family to take part. And if a family would say, no, we'll come, no, that will be a counterindication to take the person. I remember your analogy, Yehuda would say, I'm not a garagnik. I mean, I'm not, you don't bring me the car and I'll call you when it's fixed. Okay? You remember that?
Thank God I still remember. You remembered it very well.
So the message to the family was, you are expected to be involved. You are expected to be here. And some of them will come every day. At the community meeting, they'll join us. That's the first point. Second point is that the community was not open only for the patients and staff and significant others, but whoever visited us. And we had lots of visitors. Being in Manhattan, we had Annalise Christensen coming to visit us, Bureau Lisa came, George Sprigatano, you name it, everyone, Barbara Wilson, everyone was here in the program, sitting in the program and watching. We had once a discussion, I mean, how do they feel? I mean, is it like, some of them told us, I feel like I'm in a zoo, everybody is watching me. But I think the message was, you're not shy, you are expected to talk aloud about your difficulties without feeling uncomfortable about it and being exposed. Of course, not to the private sessions, but to all the group sessions, all the major activities, they were open, and visitors will be and sit with us. When we were at the Chinese restaurant, you remember the small shop we had? So it was like a small space, and you remember that? Across the street in 34. So they would come and really be among us. And I think the message was, we're not shy of our difficulties, and we talk about them. So the issue of family and significant others is very, very important.
Absolutely, you said it right.
I have another question about the filming.
Yeah.
I saw that you filmed a group, and I wanted to ask whether the patient will use this film, the staff will use this film?
Yeah. The answer is short. We don't have patients here, we have trainees. The words are very important.
Okay.
And they have to be committed, and the significant others, whether they are family or not family, have also to be committed to participate. And the videotapes, every person is entitled, the trainee is entitled to take home the videotape, which they usually borrow, and they watch it at home. I have a young lady now, I'm corresponding because my wife makes it possible for me to live in the clouds, and she takes care of life. I can correspond with a person in Philippines who went back an ex-trainee in South Africa, and one that turned out now in Arizona. So I'm corresponding with the world, and my wife takes care of life. But the point is that the videotapes are borrowed by the trainees and they can watch. But this young lady from South Africa, for some reason, they duplicated all of the exercises that she was involved in. And the last email I received from her a few days ago, she is now reviewing them again and again and again. And somehow she got a handle on the last book that Diller and I published, and she keeps reading it. Now the truth is, I believe that reading books doesn't rehabilitate you. But I said to her, God bless you, keep reading. If it helps you, read.
I want to add with the filming, we use it as therapists as a very powerful tool. especially towards the end of the program, when people say, no, I didn't change, you know, I don't see really what I changed. So we would take films, videos from the early on, you know, like in a group, and you know, you're not concentrated, all around, not focused, and compare it to videos that recently we took. And we go over them, and you show him or her. And it's so powerful because it becomes very concrete. You know, they don't have to take your word for it. I mean, you show them, look at the change. Because sometimes, because you know it's a very gradual change, we are not sometimes as therapists even aware of the change. But when you look at these videos and 6 months later you compare it, so wow, it's incredible. And so we used it as a therapeutic tool as well.
Yeah.
I want to ask Eli, maybe also Limor. Some of us has gone through Rekanati, Spitzer in Israel, so I'm really interested to hear about the accommodations that you had to do from this program to הטיפול המלא in Israel. What were the accommodations that were
I
to be
moved
made?
from here directly to run the Rekanati because Danny took a vacation for 3 years to do his PhD, and I took over. Well, there were several differences, interesting ones. First of all, the program, I don't know if it's still, but it was much longer. It was almost double.
10 months.
10 months. So it was almost double. So that's the first thing.
Just doing one session.
But I tell you two important differences that I think unique to Israel and different from here. The first thing that I encountered was the fact that patients were not coming on a regular basis. Some of them would disappear for 2 days, 3 days, a week, and we have always decided what to do, to warn them. And I started and thought, I don't remember coping with such a problem here at Rusk. And I tried to think why. And the answer is very simple. Here, they pay a lot of money per day. It's $100, $200 a day, about, I don't, roughly.
No, they don't pay the insurance company
Yeah,
or
but
the family
they're
pays.
but they're going to lose it. If they don't take advantage of it, they can't use it again. But here in Israel, you have Bituach Leumi, you have the Agaf HaShikum. Okay, you come, you don't come, someone is paying for it. And I felt that the fact that it comes from their pocket or from the budget they have from the insurance company makes a difference, and they were much more committed. So that's one difference. The other difference has to do with family, and I think we talked about it once, particularly with veterans. The whole issue of how to handle, like when couples want to divorce. I mean, since we're talking about 70-75% it's males, so what if the spouse want to leave? And in Israel, although it's changing, when I went back in the mid-80s, late 80s, it was slightly different. You know, when you have a veteran, that I had a patient, you know, he was a Sganalu, and he was a hero, but very severely injured. And like they did a birthday party for him, and all the generals came, Mufas came, and others came and said, what potential he has, he could have been the chief of staff. Okay, and how dedicated is his wife, and she's next to his bed. I mean, throughout the period he was in Levinstein, and now she's with him. Now, think how trapped she is. And at a certain point, she wanted to divorce. But everyone was talking how great wife she is, and how, you know, she's our hero, just as he is our hero. And the whole setting in Israel, when you have particularly veteran injured, the whole issue of separation, the whole issue of divorce, is much more loaded. They have more guilt, and they feel guilty. So that was another major difference that we experienced.
Yeah. A little footnote I want to add to it. Eli took care of the open part. If somebody in this program is missing 1 or 2 days, the immediate question of the staff, the personal counselor who is assigned, you are assigned from the staff a personal counselor, immediately finds out, why didn't you show up? So there is a sort of gentle kind of thing. But if it happens again and again, the person refuses to come, or argues or fights with the family to come, we quietly bring them in and tactfully say, this is not a summer camp or so on. Maybe you should leave the program and come back a month or two or a year later. It always works. So the point is the carrot and the stick. You have to be very strict when necessary. And we were on occasion, but nobody missed here. And what you were saying is, slowly you learned over there to find the Israeli way to handle absences and this kind of thing. But you can't be a member of the program. You have to commit yourself to the program, and unless you are sick, you come. And if not, there is a different levels of gentle coercion. Not shock treatments, but close to it. The worst thing you can do to a trainee, what you guys call patients sometimes, is to insinuate, to imply, maybe you don't belong to the program yet. Oh, they behave immediately.
Can you tell us about the peer counselor role?
Yeah. The peer counselors are invited if they have in their own life accepted that brain injury is permanent. They have found a way in their own life how to live functionally in a meaningful way. And you have seen a few peer counselors sitting over there. You didn't hear their feedback. But there is a number of others who didn't show up today, 2 or 3 of them. So the peer counselors are basically the trainees always in their speeches say they are the role models. Although we learn the great deal from the staff and from the coaches and from the peers, these peer counselors are for them like the end of the tunnel. They see it's possible to live a life changed.
But are they also trainees?
The peer counselors were
Ex-trainees.
all ex-trainees.
Yeah.
There's no peer counselor here without being
I
ex-trainee.
understand, but is this part of their cycle as well? Are they?
No,
are
no,
they
no.
going through a
After
cycle?
They graduated a year, about 9 years already. Some of them graduated 10 years ago, and they are peer counselors. I didn't see today one of the guys who was a professor in New Jersey someplace, and he at the beginning didn't feel he belongs there. He was unaware, didn't accept, argued, everything, and then finally he was invited to be a peer counselor. And so I asked him when they had the party, I asked him, how important is it for you? He says, this keeps me going, being here.
So what exactly do they do? Do they meet the patient? Do they
No, they don't meet individually. They come, attend the group sessions, and they basically give their feedback. The trainees, they are interviewed. They have a chance to hear through the interviews in front of the trainees about their own life, but they are the best example that the trainees can say, here is my brother or my sister who could have been me, and look how far they have gone. But they all have accomplished the necessity of accepting compensation, practicing it at home, and functioning as part of the family in a changed way. There's no cure here.
So this is what I want to ask you following your remark. The program.
Yeah.
And you have as a rehabilitation, not patient, trainee, you have to accept your disability. So I would like to ask how the program affects the trajectory of accepting the disability, the whole, on the emotional part.
By working day after day after day in this community, therapeutic community approach, they are what you call marinated, and some of them accept. Over the years that I have experienced here, we probably expelled no more than 2 or 3 people, because slowly they changed. V'yidach zilg more, as they say.
Yeah.
That's the story. So you have to be marinated, prepared, and I think for the lucky ones, it's accepted.
Maybe
But
a follow-up
all of
question.
these,
Sorry, please.
done.
Maybe a follow-up question to Eyal. Do you know how long the effect of the program holds? When they finish the cycle, do you know if it stands, if it holds? Is there a real interchange, or is this something that holds the cycle and then they need to do some other practice in order to maintain it, to preserve the...
So I mentioned before, but I'll repeat it again. How long it lasts, what you went through, depends on individuals. One, for example, different people, not the same way as others. One who went back to the Philippine Islands decided that she is superior because she had a scholarship to come from the Philippines to study here in a prestigious university. So she went back, she has contempt for the university in Philippines. She's capable of working some clerical stuff, but she's too big for that because she wanted to be a research psychologist. And in her case, it took about a week when she went back to Philippines to unravel all. So she's like, she keeps asking from me or from David or from her counselors to send her articles. But her mind is still, as soon as she went back to the Philippines, everything she learned here was gone. The other one in South Africa, it took her about 1 year until it unraveled. And there are others also. So how long depends on an individual. What I have found out to my amazement is that before that, I repeat again what I said, significant others, not significant, peer counselors are the most stable, because if you ask them, they say coming here, participating keeps refreshing and renewing. So you need booster shots.
With your permission, I want to add something about the follow-up after the program. I'm not sure that things are done the same as my time, but the program ended, but then we had the vocational counselor, Salim, and Silver counselor. And once they finish here, she would take over, and for almost a year, we would find placements within the hospital, like as a secretary here, helping in the lab there, and so and she would meet with them on an individual basis. She would instruct their bosses. She would have group meetings with them. So to adjust to the real world and to really accept authority, being on time, etc., etc. So and that was like a branch or a continuation, an extension of the program. That's one thing. The other thing that I really would like to ask Yehuda to talk about is as we know, if eventually you go through such a beautiful program and you see improvement, but then it's not translated to the real world, then everything is lost. And I think one of the things that I learned from Yehuda is really, it's so critical to think, when we do all these assessments, what is our recommendation and what to continue, what is suitable for this person. I think Yehuda was really a genius in this sense of understanding what are the ideal circumstances in which this person will succeed. And I was
just wanted to ask, are there any advice for the new generation of psychologists, or some wisdom that you'd like to pass on?
No, but I think what they have seen and what they have heard is, if you really want, first of all, they probably are doing a good job where they are now. They learned from the guys, from that of him. But the advice is, if you really want to feel how you peel the onion backwards, come and spend a few weeks and watch and see, and then you won't have any questions. That's my biggest advice.
But I have a question.
Sure.
You talked about the huge success with that surgeon, and we've seen Adam graduation, which was very exciting, and everything about this place screams success. But what happens on the other side when there's failure or disappointment?
Okay.
How trainees cope with that after cycle, that they don't progress as they wanted or as you wanted?
Yeah, there are two variations to it, and it involves only a handful. You could count them on one hand. Two of them I remember were simply kicked out from the program. Not with a boot, but they were kicked out very nicely. You don't belong here, because they were obfuscating, they were basically not accepting the thing. About 2 or 3 over the years, and I'm talking now almost 50 years, 2 or 3 over the years said, this is not for me. But when you're talking about failures, if you are a failure to accept and to make the transformation, the necessary transformation is brain injury is permanent. I am no longer capable of doing everything I did. Instead of crying over spilled milk, what I used to be or what could have been, let me do what I can do. So this is basically the point. There is no failure here, only successes. But there were about 4 or 5 people who, some of them left on their own volition because this is not for them, with encouragement, and 2 of them at least were kicked out because they were disturbing everything.
I have a question from a training perspective. So, your legacy, I see the framework and the approach, strategies to work with the trainees is wonderful, beautiful. How do you make sure when you train the psychologists to adopt all the ins and outs, make sure the fidelity, make sure all the things is implemented when they're doing the program?
Well, you have seen the young lady sitting there. She's a member of the staff. She is a neuropsychologist, but basically her job is to supervise their adaptation to the work trials. Mm-hmm. And her manner, she's a little bit shy, so I'm a little bit deaf. I didn't hear exactly what she said, but I can imagine already. More or less, I picked up what she was talking about. The point is that the staff who belong to this kind of work are only a handful of people. People who don't have the capacity to learn and to be empathic without saying oy vey, remain cool and calm, and when necessary to be straightforward, I think don't belong into this field. So is that answering the question? I can add some more.
So how do you select these group of people, train them, and ensure that they are really doing what you have all in your heart, in your
Gotcha.
Mm-hmm.
To be very brief about it, I don't know how much money you have, but the Oxford University Press published the first book that Diller and I wrote, which described different aspects. There is a whole big chapter over there, how you pick people to the staff, and what you do to be a leader of the group like this, and so on. So, but unfortunately, there is also several hours of DVDs, videotapes. Oxford University Press charges a lot of money for their book. So the last one that we published, we made sure that it's going to be no more than $20 to $21. So I said, students, if you want students to learn so on, never mind the royalties and so on. So if you have enough money, you could buy the first book, and then you will read all this details with examples and everything.
But there were, I remember,
Done now.
We have to go downstairs in about 2 minutes.
Yeah.
Oh,
I would say, Yehuda, I have had the honor and pleasure of being able to listen to you for about 34 years. And your brilliance, and I think what I would say to pass on in terms of new staff coming in is the ability to understand the neuropsychological and the psychological, and to integrate those two so perfectly in thinking not only what the goals are for an individual and to lay those out, but also to incorporate that into either a work trial or an academic trial, so that that fit requires that you as a psychologist are thinking not only about the cognitive issues, but about who the person is and how to capture for that person in the right words that the person can accept what some of the goals are, that little by little help them to move forward as they gradually go through the program and hopefully move toward acceptance.
I will find, I know we have to go someplace.
In about 3 or 4 minutes.
Yeah. Talking about brilliance and so on. Kurt Goldstein, you must have all heard about him. I was fortunate, he was my student, my teacher here when I arrived to the United States. It was 56 years ago. So Kurt Goldstein was a wonderful old man at the time, and he liked me, and I wasn't very fluent in writing English. I understood, obviously, so I asked him to give me an oral examination. After that, I took 3 more courses with him until 1961, I think, 1960. I took 3 more courses, and always we had oral examination. So on one of these oral examination, the fatherly Kurt Goldstein gave me a pinch on the cheek. He said, "Clever boy." I never took a shower after that.
I think that's as good a note to end on as any. So we're going to move downstairs to the ground floor where lunch is going to be served.
Well, it looks like poor Lenny couldn't make it, but he is here.
Thank you very much.
Thank you.